Hey everyone, it's Dr. Samir Undavia back to you again from Princeton, New Jersey. And today I wanted to cover some of the more frequently asked questions about Botox and other botulinum products. So one question that I get asked a lot is whether Botox can cause droopy eyelids. And the answer is yes. It shouldn't happen, but it can occur. And it occurs for a few reasons. Number one, there could have been some bruising around the upper eyelid. Number two, Botox could have been accidentally injected into the levator muscle. Or number three, the eyebrow itself could have been dropped and then it pushes on the upper eyelid. Now this is a rare potential side effect for Botox, especially when it's injected around the eyelids, but it shouldn't occur if you study the patient's anatomy prior to injecting. If it does, it can be treated. There's an asymmetry that typically will last for a few weeks, and if we prescribe a drop for it, that asymmetry becomes much less, and it's hardly noticeable. Another frequently asked question is whether Botox can give you an arched brow, and the answer is yes, and it's one of the great advantages of Botox. Now as we age, we lose volume of tissue in our skin and in the muscles, and this can cause a drooping of the eyelid complex. So Botox can be used to help recalibrate this or rebalance this area. Now for women, they look great with an arched brow. But men, we have to be careful with because men look better with a straighter brow. So we change our technique so that they don't get a feminine or an arched brow. Now one final but very important question about Botox is whether it can be used around the mouth. And the short answer is yes, but I'm not a big fan of it and it's not an FDA approved indication. And there's good reason for it. In a recent study, up to 20% of people had problems afterwards. Some people had a droopy or asymmetric smile, and some people had difficulty drinking, especially with a straw. So this is an unacceptably high complication rate, and that's why I think it's better to use fillers in this area, because it's safer and you get better results. So I hope this was informative. If you have any other questions about Botox, Dysport, or wrinkle fillers, please email me at info@drundavia.com or call me at 609-403-8840. Thanks for tuning in. Remember, trust your face to a specialist. And until next time, I'm Dr. Undavia.